This is where it started. This is a definition of syndromes of uncertain origin, which appeared in the Merck manual in 1999, when I got involved with all these things. What were all these things? First, Gulf War syndrome. Secondly, ME, CFS, and fibromyalgia as well. Third, multiple chemical sensitivity. And fourth, organophosphates. So I got snowballed, really. I was going downhill, getting into a bigger and bigger snowball, and trying to breathe. The problem with all these illnesses is that they have a vast range of signs, clinical signs, including all aspects of the human being, really, neurological, cardiovascular, immune, and gastrointestinal, respiratory. This is a quote from Stephen Strauss, who said, "Considering the extent of the patient's complaints and disability," so that's acknowledged, these patients have got a real problem, and they've been disabled to a degree, the results of routine laboratory tests were strikingly normal. Therefore, you're all right. Or you're crackers, really. That was a sort of summatisation. It's a psychiatric illness. Well, we're going to blow that out of the water in a moment. Come on. Why are you not moving forward? Right. Oops, go back. Come on. Right. Now, that's right, we've got this slide. This is an old slide, but all you need to look at is concentrate on the pluses, and they're all over the place. And what it's saying is that these are the symptoms that people report when they've got OP poisoning or Gulf War syndrome or multiple chemical sensitivity. The giveaway is in the end of this slide, where you've got MS, which is a known neurological disease. MS, a non-neurological disease, and AIDS, which was then called AIDS, which is a retroviral illness. So there's something going on which covers diseases which have this sort of issue. I've highlighted the gut here because the gut is now a big player in almost every of these diseases, particularly in autism, which I hadn't mentioned earlier, but I got involved with that as well. So the gut is a big issue, and we were using a gut test and getting positive results for Gulf War veterans from our gut test used for autism. So there's a whole range of stuff that is been going on for some time now. This is trying to make sense of it all in the early days. You've got many insults, so people say, you can't have this many insults. Yes, you can. You've got a whole range of diseases here which are represented by cancers, inflammatory diseases, especially cardiovascular. These are the people who've done the work. Van Spence started that one off. Jonathan Kerr looked at the genetics, particularly Jonathan, although Gow was there as well, and later Schutzer and Kogelnik. The RNase dysregulation mechanism, the antiviral processes, is Candida myla, which you probably know about, and virus susceptibility, the enterovirus, the Coxsackie B especially, herpes, Epstein-Barr, etc. This is the work of John Richardson, who taught me all I know about ME, and it's been picked up later by John Chia in the States. Martin Lerner is one of the big figures, along with Kogelnik and Montoya, who looked at herpes viruses as the basis of ME. But herpes viruses have similar spectrum of disorder, not exactly the same, but similar. This is Jonathan Kerr's attempt at it, which I borrowed this from Jonathan some time ago now. He looked at genes, 88 genes he identified in ME patients who were very sick. He went to the very sick patients and used a blood sample to pull out the different genes that were involved in their illness. And again, he's saying things which about there's some common pathways have been fed into by these different insults, resulting in the expression of the disease, which got called CFS-ME it got called CFS in 1988, long after ME had been established and still is established in the International Classification of Diseases. So this is my attempt to get hold of this situation. I liken it to a lake into which a stream flows, which is fed by other streams, all running into these ME-like symptoms. And you'll hear later about Borrelia-like symptoms as well, or Lyme-like symptoms. The first, at the top of the river is the enteroviruses. And these flow down here, and these are the initial ME people. This is Melvin Ramsey's definition, and he was followed later by John Richardson as well, who I work with a lot, and Irving Spur. Then the herpes viruses came into the story, and then chemicals, including the OPs obviously, other intercellular organisms, Lyme, Q fever, rickettsia, chlamydia and mycoplasmas, vaccine damage you see in patients, which result in the same kind of spectrum of symptoms, and this last one is traumatic brain injury, which again gives rise to the same spectrum of symptoms. So what can we do about this? Well, enterovirus infections have been treated for a long time now, for over 40 years, using pooled human immunoglobulins, and they work. But there's people pull funny faces about this. But Irving Spur and Dr. Richardson had 3,000 patients, and they've treated them. So 3,000 is quite a big number to treat, with no real problems at all. Herpes is even better. People with herpes infections are now eminently treatable with the new valciclovir family, valaciclovir, valganciclovir. This is work that's been done particularly by Martin Lerner. He's developed very good protocols for this. And intercellular organisms, other intercellular organisms, it all seems to be intercellular stuff, which I was learning last night about the pleomorphism of Borrelia, and they then encyst, as it were, inside the cell and become latent and give rise to the long-term effects of chronic Lyme disease. Vaccines, the key to vaccines, sorry, I've gone too fast there. The key to vaccines is in the Gulf War. They were given vaccines, they were given 8 to 10 to 12 shots in one day, which anybody who knows anything about giving vaccines would say, this is absolutely crazy. And it proved to be crazy. And there's damage for Gulf War veterans. They've got lymphocytic hypophysitis, so they've lost pituitary function. They've got zero gonadotrophins. They've got very low growth hormones. And they've got testosterone levels through the boots. And the wives will tell you that. They won't tell you that, but the wives will tell you that. So other viruses which you mentioned, occasionally parvovirus, which Jonathan Kerr worked with. So that's out of this lake flow all these different symptoms that you see at the bottom here. Multiple symptoms affecting all the nervous systems, the CNS, ANS, the immune system, the endocrine system, and the cardiovascular. So there's a whole. This is just one way of arranging these things, and I did this simply to show that if you can find enterovirus and identify it, you can treat it. If you can find herpes virus and identify it, you can treat it. So things can be done. So we can clarify the situation and not just have a ragbag of people who could have anything who've been brought before a poor old GP who's trying to work out what on earth's going on. This is the latest publication. It's just come out. It's looking at enteroviral ME, and there's some very simple clinical tests there, as well as some biological tests. And that's, again, come out of the John Richardson Research Group, of which I'm a member. I think this is just an absolutely incredible piece of science. These are the proteins identified in cerebrospinal fluid in post-treatment neurologic, post-treatment Lyme disease, ME/CFS, and you can see they've all got a large number of proteins, but there are some which are distinctively belonging to the different disorders. So CFS is 700. I don't know how you dig these out. I don't know how this is done. It's all clever stuff. 738 different proteins in the cerebrospinal fluid, which are distinctively associated with CFS patients. And with Lyme's, you've got these at the bottom. You've got another 692. There's a lot of overlap, so this would explain some of the confusion with these diseases. But I think this is a magnificent piece of work, and it just shows how complicated the situation is and how difficult it can be to engage with it. I think this is very important because there's some very good news coming up. I've used this slide many times in various things. This is the definition of ME. ME is, 1969 it was introduced in the ICD-10, ICD-9 it was then. An allowed alternative name was CFS, which was only introduced in 1988 in a big American symposium. ME represents a pathophysiological condition. It means inflammation of the brain and spinal cord and muscle pain. It gets reduced to a viral inflammation with post-viral fatigue, which is still okay. Then chronic fatigue syndrome is a symptom. It's subjective. It has no clinical science for diagnosis. It makes mischief possible, and the mischief is possible is to make it even vaguer with encephalopathy and the decreasing objective information for clinical, diagnostic, scientific and etiological purposes. So you're getting to know less and less about it. You've got something that is so general it doesn't mean very much. This is P2P. Now I want you to read this very carefully and cheer, okay? The Oxford criteria, this is published 2014. The Oxford criteria, which are the psychiatric definition of ME, which is used in many, many papers, the Oxford criteria are flawed and include people with other conditions confounding the ability to interpret the science. This is a rag bag. That's what you've got. What does it mean? You can't tell because you've got a mixture of people. The lack of consistent, specific, sensitive diagnostic tests you can all read is hampered. Clinicians have a poor understanding of ME/CFS, which is something that many patients will complain about. But even better to come, the Oxford definition should be retired, and studies using the Oxford definition not be used to inform treatment. This is CBT and graded exercise, often with antidepressants. They should be abandoned altogether. This has finished. The PACE trial is dead. It's a dead duck, and they went on to talk about the Canadian criteria. I don't know how they missed the international criteria, which is a bit later. This was constructed in dialogue with the ME/CFS community, and they're still trying to find a diagnostic definition. And the patients, clinicians agree on a definition for a meaningful recovery. So this was a P2P, it's patients and pathways for treatment. This is the last bit. From these two reports from the USA, I've not mentioned earlier the IOM, but the IOM report says CFS should be dropped, which it should be, because it doesn't mean anything. The PACE trial is declared null and void. It's a failed trial. NICE must alter its advice on ME/CFS. The Department of Works and Pensions must drop the espousal of the PACE results to justify lowering benefits. The insurance companies must pay out on policies, which they don't, refuse to do since it's psychiatric. And the people at the bottom here, Science Media Centre, as well as NICE, government, DWP, must face this truth. So that is the good news, and I think that is the end of it all. Hooray, well done.